This year, like every year in Canada, 700 young Canadians will die. Young in medical terms is defined as under age 35. 700 young Canadians will die of cardiac causes, die suddenly. We know that it affects every community. It came and visited this community again this week when a 22-year-old hockey player died working out at University of Waterloo. I think there's a lot of important messages around that 700 number. The first message is that half of those young people who die suddenly actually exhibited warning signs in the days, weeks, or months prior to their death. And if we learn those warning signs and we pick up on those warning signs, we can get those young people to the right doctors and find out what's happening with their heart and get them treated. And so I really do encourage you to go and see Pam at some point today at the SADS Foundation booth and learn a little bit more about the warning signs. The posters are all around us. But the long and the short of it is, when kids faint, get them to a doctor. When kids faint, get them to a doctor and find out why they're fainting. Most faints are benign, but a significant number of faints are sinister. It's a warning sign that this child, this young person, has a heart rhythm disease. And of course, the other piece is, when we miss the warning signs, or the child doesn't, or the young person doesn't exhibit warning signs and they collapse to the ground unconscious, not breathing, no pulse, we need to have the tools to save their life. And they're really, really easy tools to acquire. It's two things, well, maybe three. Call 911. Start some really good chest compressions, some really good CPR chest compressions, and if there's a defibrillator available, grab the defibrillator and apply it to the patient and do what it tells you to do. And there's a few of you out there that aren't really good at doing what you're told. I can spot you from here, but please, in this instance, just listen to the machine and do what it tells you. So as soon as you identify that a person's collapsed, I'll say to you, can you go call 911? Thank you. And then let's get started with some CPR compressions. Here, just hold that for me. Put the heel of your hand down the middle of the chest, interlock, and just push down 2 inches. 1 and 2 and 3 and 4 and 5 and 1 and 2 and 3 and 4 and 10. Heel of your hand in the middle of the chest. Push down 2 inches. 1 and 2 and 3 and 4 and 5 and 1 and 2 and 3 and 4 and 10, and pretty fast, almost 2 a second, over 100 beats a minute. Keep that blood circulating. As soon as the defibrillator arrives, place it above the patient's head and turn it on. And then just do what you're told.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
That's the fun part.
When patient's chest is bare, remove protective cover and look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. When the first pad is in place, look carefully at the picture on the second pad. No one should touch the patient. Analyzing. No one should touch the patient. Analyzing. Shock advised. Stay clear of patient. Press the flashing orange button. Shock delivered. Be sure emergency medical.
And as soon as you deliver that shock, just get right back to compressions.
The patient. Begin CPR. For help.
It's that easy. Quality chest compressions. Grab the defibrillator, apply it to the patient's chest, follow the voice prompts. I'm going to be upstairs after the run if you want to come by my display and practice some CPR on a mannequin. Get hands-on with the defibrillator. Just make sure you've got these skills down pat. So for those patients who don't exhibit warning signs and we can't get them to the hospital and prevent that cardiac arrest, we can treat it when it does happen. Have a great run, everybody.